Hi everyone, my name is Helen. So my partner Katy and I will be presenting on case studies. I will be covering the first portion and Katy will be covering the second half. So the learning objectives for our presentation today are to understand the defining features of case studies as well as the background and origin, to describe the various types of case studies, to review the philosophical underpinnings of case study research, to discuss examples of case study research that have been conducted, to compare and distinguish between case study and phenomenology, to learn about the strengths and weaknesses of case study research, and lastly, to review the emerging trends. What exactly is a case study? So there are several major players or thinkers who write about this method, and they all weigh in slightly differently on how a case study should be defined. For the purpose of introducing this research methodology, we have chosen a definition from an article written by John Creswell that we think encompasses nicely the features and characteristics of the case study method. To note, John Creswell is also the author for the textbook for this course, so we also thought that just gave this chosen definition a bit more credibility. So the definition is, case study research is a qualitative approach in which the investigator explores a bounded system, a case, or multiple bounded systems, cases, over time through detailed, in-depth data collection involving multiple sources of information, and then reports a case description and case-bound themes. And those multiple sources of information can be observations, interviews, audio-visual material, and documents, and so on. So what exactly does this mean? So let's take a look at the defining features of a case study to fully understand this definition. So case studies generally all have the following defining features that make them case studies. So first, there needs to be identification of a specific case or a unit of analysis or entity of interest that will be described and analyzed. So for example, the case may be an individual, a community, an event, or even a decision process. A major hallmark of the case study is that it provides an in-depth analysis and understanding of the phenomena or case to be examined. So to accomplish this in-depth understanding, data is collected from multiple sources, as mentioned before. So this ensures that the issue is not explored just through one lens, but rather a variety of lenses, which then allows for multiple facets of the phenomena to be revealed and understood. So for example, researchers can use, as mentioned previously, they can use the following methods like observations, interviews, audio-visual material, archival records, physical artifacts, documents, and reports, etc. And all of these can be used within one single case to give it that in-depth understanding. Another very important defining feature, which was mentioned in the definition, is that the case is bounded. This means that the case can be described within certain parameters, such as a time frame that the case is studied, or a specific place, or even certain people. So for example, a case study involving women who are deciding whether to have reconstructive surgery post-mastectomy, the boundaries of the case could be single women in their 30s who have received care in a tertiary center in a specific hospital in Ontario within 6 months of having a radical mastectomy. So essentially you're fencing in what you're going to study. So it's very similar to inclusion and exclusion criteria and other methodologies. However, it has specific boundaries. So for example, you wouldn't study every woman in her 30s that is considering reconstructive surgery, as this would be an endless number of women. Instead, you would bind the case by saying only those who've had a mastectomy at a specific hospital within 6 months of surgery, let's say. So this becomes your case. It's very similar to inclusion and exclusion criteria, except with a finite number of participants. Another defining feature is that the case can be a single case or it can be multiple cases that can be used for comparison. So for example, it can be one ICU at a specific hospital, or it can be 2 ICUs from different hospitals that can then be compared. And then lastly, data in a case study is collected in real time. It's not often done retrospectively. Another feature of the case study that I wanted to touch on is the philosophical underpinnings of this type of research. So most researchers base their approach to case study on a constructivist paradigm. So as you already know from the content we covered in week 1, constructivists claim that truth is relative and is dependent on one's perspective. So the case study requires collaboration between the researcher and the participant, enabling participants to tell their stories. So it's through these stories that the participants are able to describe their views of reality, which allows the researcher to better understand the participants' actions. And this social construction of reality, therefore, underpins the case study methodology. As researchers work with participants to gather an in-depth view of the unit of analysis or the entity of interest. So what is the focus of a case study? So first of all, a case study can be used to eliminate understanding of complex phenomena. So essentially, the fundamental goal of qualitative case study research is to conduct an in-depth analysis of an issue within its context to gain understanding of the issue from the perspective of the participants. So case study research can be used to study a range of topics and purposes. However, the main reason for employing a case study stems from one's motivation to illuminate understanding of complex phenomena. So because case studies are primarily exploratory and explanatory in nature, they can be used to gain an understanding of the issue in real life settings, and it can be used to answer the how and the why and the what questions surrounding a particular phenomena of interest. So to sum it up, a case study can be used as a method for researchers to develop theories about a phenomena, to evaluate programs, and develop interventions. So really, as you can see, case study methodology is highly appropriate for nursing research, as it can really focus intensely and deeply on complex phenomena of life. Background and origin. So case studies have a long history across many disciplines, from psychology, such as the case studies that Sigmund Freud conducted, to case studies of medical problems, to law, where they would use case law, and political science in the terms of case reports. So it can be traced back as far as the 1900s. There are, in fact, a few historical examples that can be traced back even further, such as noted in the biography of Charles Darwin from the 1800s. So he conducted what looked like case studies in his research of evolution, but the origin is more commonly thought of being in the early 1900s, with roots in anthropology and sociology. So sociologists and anthropologists in the early 1900s began investigating people's lives and experiences and how they understood the social and cultural context of their world, with really the aim of gaining insight into how individuals interpreted and attributed meaning to their experiences and constructed their worlds. So next, we are going to compare case study to another qualitative research methodology, and that research methodology is phenomenology. So we know that the research focus for case study is to develop an in-depth description and analysis of a case or multiple cases, whereas for phenomenology, the researcher is looking more at the lived experiences of individuals to really get at what the phenomena or experience means for those people that are living that experience. So essentially, they're looking for the personal meanings of that experience. Both methodologies really take a deep dive into individuals' experience, but case study is more focused on describing the peculiarities and the commonalities of the dimensions and the processes of the phenomena, whereas phenomenology is more focused on that human experience of the phenomena and what it means to that person or those individuals. So in terms of the unit of analysis, for case study, as mentioned before, this could be, for example, an individual, an event, a program, or an organization. The unit of analysis for phenomenology are several people who have shared a similar experience. So when looking at, for example, uncovering the meaning and experience of childbirth from fathers' perspectives, the unit of analysis here would be the group of fathers who have shared that similar lived experience. As mentioned before, case study originates in psychology, law, political science, and medicine, whereas phenomenology originates in philosophy, psychology, and education. Data collection methods for both methodologies include interviews. However, phenomenology focuses heavily on interviews and then supplements this with data from documents and observations and art, etc. This really provides a rich overview of that lived experience. With case studies, however, many different forms of data collection are used in one case study to gather a really good description and lead to that deep analysis. So the researcher will use interviews, observations, documents, artifacts, reports, and they'll use them all equally in one case study, or more on one and less on the other. It really depends what can really give that deep analysis. When we're looking at data analysis, the data analysis for case studies involves analyzing and describing the themes of the case, or if using multiple cases, then looking for cross-case themes. On the other hand, when looking at phenomenology, the researcher will pull out significant statements and significant portions of transcribed text to describe the overarching theme or essence of the experience. So both case study and phenomenology are excellent research methodologies for nursing. Both really allow for rich, meaningful data to be collected that can contribute to moving research forward in nursing.
So, what are the various types of case studies within this particular methodology. In the next few slides, we are going to look at some various types of case studies in depth. And the questions that we're going to answer are what is the type of case study? What questions do those types of case studies answer? When are they used in research? And then there will be a published example that you can look at if you're more interested in taking a look at how these methodologies have been published in research. When taking a look at the various types of case studies, it is important to note that the selection of a specific type of case study design will be guided by the overall study purpose. Case studies help researchers answer questions about the how, the why, and the what within a particular phenomenon. Factors to consider would be, are you looking to describe a case, explore a particular case, or are you looking to compare between cases? The first type of case study that we'll look at is called the exploratory case study. And the questions answered within these types are the how or the what. This type of case study is used to explore those situations in which the intervention being evaluated has no clear single set of outcomes. An exploratory case study is usually the precursor to a formal, large-scale research project. The case study's goal is to prove that further investigation is necessary. The next type would be the explanatory, which will tend to answer the questions of the how or the why. This type of case study would be used if you were seeking to answer a question that sought to explain the presumed causal links in real-life interventions that are too complex for the survey or experimental strategies. Explanatory can use both qualitative and quantitative research methods. Explanatory case studies not only explore and describe phenomena, but can also be used to explain causal relationships and to develop theory. The next type would be a descriptive type of case study, which answers the how, what, and why. This type of case study is used to describe an intervention or phenomenon and the real-life context in which it occurred. When looking at multiple or collective case studies, they also answer the questions of how, what, and why. A multiple case study enables the researcher to explore differences within and between cases. The goal is to replicate findings across cases. Because comparisons will be drawn, it is imperative that the cases are chosen carefully so that the researcher can predict similar results across cases or predict contrasting results based on theory. This type of study involves collecting and analyzing data from several cases and can be distinguished from the single case study that may have subunits or subcases embedded within them. Looking at comparative cases, these cases are asking the question, how are the cases alike and how are the cases different? Used to compare two or more cases, sometimes referred to as multiple case study because there is more than one case, but the primary focus is on the comparison of cases, which differentiates them from multiple case studies in that regard. Comparative case studies involve the analysis and synthesis of the similarities, differences, and patterns across two or more cases that share a common focus or goal in a way that produces knowledge that is easier to generalize about causal questions, how and why particular programs or policies work or fail to work. The next we'll be looking at is the instrumental case study, which is also answering the questions of how, what, and why. And these ones are used to accomplish something other than understanding a particular situation. It provides insight into an issue or helps to refine a theory. The case is of secondary interest. It plays a supportive role, facilitating our understanding of something else, The case is often looked at in depth, its content scrutinized, its ordinary activities detailed, and because it helps the researcher pursue the external interest. These cases may or may not be seen as typical of other cases. The last type of case study that will be discussed is called the intrinsic case study. And the questions answered in this type of case study would be the how, or the what, or the why, but the focus is very specific. This type of case study is used when researchers have a genuine interest in the case, and the intent is to better understand the phenomenon of interest. It is not undertaken primarily because the case represents other cases or because it illustrates a particular trait or problem, but because it, in all its particularity and ordinariness, the case itself is of interest. The purpose is not to come to understand some abstract construct or generic phenomenon. The purpose is not to build theory. It's recommended when the researcher is actually interested in gaining insight and or understanding into a unique situation or phenomenon. The word intrinsic simply means that one has an intrinsic interest in a subject, and you are aware that the results have limited transferability. So, when looking at case studies, what are the strengths and the weaknesses of case study research? So now we're going to look at some of the strengths and weaknesses to case study research. As with any methodology, you're going to have some strengths and some drawbacks as to this approach. One of the strengths of case study research is the depth. Case studies provide a detailed and holistic account of a phenomenon. Another strength is the understanding of context and process as it investigates certain and specific aspects of cases within their context and real life situations. It helps us to understand what causes a phenomenon, linking causes and outcomes. Research tends to be predictable in nature due to the controlled condition, which increases understanding and insights within the context of the case study, which helps us to foster new hypotheses and new research questions. The case study offers a means of investigating complex social units consisting of multiple variables of potential importance, including understanding the phenomenon, which again leads to fostering new hypotheses and new research questions. Some of the issues or weaknesses would be reliability, validity, and generalizability. Case studies have been faulted for the lack of representativeness, lack of rigor in the collection, construction, and analysis of the empirical materials that gives rise to the study. The lack of rigor is linked to the problem of bias introduced by the subjectivity of the researcher and others involved in the case. There can also be issues that can be subject to unusual problems of ethics. An unethical case writer could so select from among available data that virtually anything he wished could be illustrated. Both the readers of case studies and the authors themselves need to be aware of biases that can affect the final product. Furthermore, on the strengths and weaknesses of case study research, for strengths, case studies play an important role in advancing a field's knowledge base. Case study improve humanistic understanding of complex phenomena. Because case studies are anchored in real-life situations, the results can be a rich and holistic account of any phenomenon under investigation. It offers insights and illuminates meanings that expand its readers' experiences. These insights can be construed as tentative hypotheses that help structure future research. Hence, case study plays an important role in advancing a field's knowledge base. Because a case study's ability to improve humanistic understanding of complex phenomena, it is a particularly appealing design for applied fields of study such as education, social work, administration, healthcare, and so on. When looking at weaknesses, the case study approach can provide a weak understanding of occurrences in a population of phenomena under study. Collecting and analyzing case study data is highly labor intensive, and it tends to be expensive and can lack feasibility. The researcher may not have enough time or money to devote such an undertaking. And assuming time is available to produce a worthy case study, the product may be too lengthy, too detailed, or too involved for busy policymakers and practitioners to read and use. When looking into the emerging directions of case studies, it is clear that case study research is considered to be a very classic and traditional method of qualitative research. For this reason, there is limited literature referring to new and emerging directions. Over the past 50 years, case study has grown in sophistication and is viewed as a time-honored form of inquiry to explore a broad scope of complex issues. Due to the classic nature of the case study methodology, many researchers are moving away from this method as more contemporary methods become available. However, many methodologists cited as guiding case study research argue that this method is a valuable form in any exploration of a bounded system, providing a rich and detailed description of complex social systems, such as in the healthcare setting. For the last part of the presentation, we're going to share a video by Dr. Shan Darrell Mohammed from the University of Toronto. He's going to discuss some of the ways that he utilizes case study research and will describe an example of a research project that was conducted about oncology, palliative care, and treatment options. We hope that you enjoy.
Hi everybody, my name is Dr. Shah Mohammed and I'm an assistant professor in the teaching stream at the Lawrence S. Bloomberg Faculty of Nursing at the University of Toronto. I'm also an academic fellow at the Center for Critical Qualitative Research, also at the University of Toronto. So my own research interests include palliative care and end-of-life care, nursing ethics and critical qualitative research, and also cancer research. So today I'm going to talk to you about case study research, which is a really interesting and exciting way to do qualitative research. Before I begin, I'd like to talk a bit about cases. So cases have been a part of how we think of the health sciences and in medicine for many years. For example, one of the most famous psychiatric cases was Dora by Sigmund Freud, which was a single patient case where he developed ideas about hysteria and psychoanalysis. Freud later applied knowledge gained in the case of Dora to similar patients with similar diagnoses. Examining cases is also part of how students in the health sciences learn about clinical practice. I'm sure people have had experiences where the professor gave a lecture and then provided a case about pneumonia or sepsis to illustrate the material in more depth. Even clinical rounds at a hospital are about how a healthcare team might discuss a difficult patient case. Case study is used in the health sciences, but also in political science, geography, and the social sciences. In the health sciences, cases have been used to examine diabetes, cardiac care, and healthcare leadership. Case study has also been used in quantitative and mixed method literature, but today I'm going to talk about qualitative case study research. So we already know about cases, but today I want to introduce the unique ways I use the method in my own research. For example, in my most recent case study, I collected case studies of how patients with advanced cancer sought biomedical treatment like clinical trials. And I'll speak more about this study as an example of how researchers like myself might assemble a case in their work. To highlight my discussion, I'm going to focus on three main themes. So some of the benefits of critical qualitative case studies is that it encourages researchers to select or focus on a bounded or narrow topic. It allows for diverse types of information to be collected by the researcher, and also provides a way for researchers to think about different viewpoints about a particular topic. So to conclude the talk, I'll make recommendations for the next steps for people who are interested in conducting qualitative case study or using it in their own academic or clinical work. So case study is considered to be an older form, traditional form of qualitative research. However, case study, I feel, still has relevance for research today. In general, case study focuses on how and why questions in research. For instance, why is something happening repeatedly in clinical practice? How is it that this event keeps on happening? Case study also develops in-depth and real-life contextual information about a topic. So the ability of case studies helps researchers to delve deeper into a clinical problem, understand its contexts, which is a form of strength about this method. Also, if researchers are strategic in how they assemble the cases, the type of research can provide knowledge about a topic beyond the actual case being examined. It can be transferred to other situations. So I want to talk to you about bounding and how to bound a case. So one of the important questions that I often ask in my work is, what is this a case of? And I want to talk about some of the strategies for bounding a case. And this might include focusing or narrowing the case, which is a very important part of case study research. So usually I focus the case to fit the very specific objectives of a study. Another consideration is whether I want to collect typical or atypical cases, or perhaps a combination of the two cases. So a typical or representative case is a case that often doesn't deviate from the norm, or what commonly occurs in a particular situation. An atypical case, which is sometimes called a radical or outlier case, examines an unusual phenomenon that often doesn't happen in everyday life or clinical practice. So since they involve mechanisms or processes that may be unusual, examining atypical cases often provides more information than a typical or representative case. So the unique information provided by an atypical case might be of interest to students, researchers, and also clinicians. So I wanted to provide a very short example of how I narrowed the focus of my cases in a research project about cancer. So I knew I was interested in treatment choices in cancer. However, the topic of treatment choices seemed too broad to collect cases on. So I narrowed my topic to choices at the end of life. But this also seemed a bit too broad to collect cases on. So for instance, there may be several choices at the end of life, the choice to do advanced care planning, or maybe the choice to die at home. So I decided to narrow the cases to oncology treatment choices in advanced cancer. So I felt that this was a more focused on a type of treatment. So for instance, the choice to treat cancer with chemotherapy or radiation therapy. Moreover, it tends to be more focused on a particular phase of disease, that is advanced cancer. However, I knew that I wanted to bound or limit the case even further. Otherwise, there may be some concern about would the cases be too broad. For example, if I've just focused on oncology treatment choices, would that mean that my cases would be focused on oncologists or nurses or even pharmaceutical companies? So after some thought, I knew I wanted to collect cases on the choices of patients. So the final focus of the cases was the choices of advanced cancer patients around their oncological treatment. So this research focus I felt was very bound. So for instance, it helped me focus my own analysis. We may want to know a little bit about the comorbidity of the study participants, and we might want to know a little bit about their early diagnosis. But the main focus of the cases were the choices that people with advanced cancer made around their oncological treatment. So before researchers begin to collect data or information about a case, they have to think critically about what should be included. Moreover, they'll have to think about what is a starting point about the case. So remember in the introduction, I spoke about how case study can promote an in-depth examination of a topic. So one of the distinctive features of case study that I use in my research is that it includes many forms of diverse research data. So for example, a case might include interviews with different people, it might include documents like policies and blogs. It might also include researchers' observations of different events. And cases may vary in their composition. That means that if you're collecting multiple cases within a project, each case might be different. For instance, one case might involve lots of observational data, another case might not have any observational data because it's not as relevant to understanding that case. So when collecting case data, case study researchers in general compose cases to create a really rich picture of the research topic and also to get a sense of the context that informed the case. So this is a sample of what a case might look like from my research. So as I said, it's an example of the work that I've done. So in this case, the patient is seeking additional oncological treatment, and they're at the center of the case. And I build the case around this particular person to understand why this patient seeks these kinds of treatments, and also how do patients make this decision. So part of this case includes an interview with a family physician, It also includes an interview with a family member. In addition, this case includes observations of appointments between patients and physicians to understand how they communicate with each other, what types of information they exchange during those meetings. Also, during interviews, I ask patients to name any magazine articles, websites, books, and social media that they use to make treatment choices. So I also included in this case a blog about cancer treatment as part of the case. So just a reminder that each case in a research project might look different and might have different composition depending on the case and what it's about. So the final point of this video I wanted to make was to highlight how case study research can encourage multiple perspectives about a particular event or issue. So case study researchers like myself often consider different types of research data collected within a case, which can provide very valuable information and may be part of the final study results. So the different perspectives about a topic may be similar, they may be different, they may be contradictory. But I might want to consider why are they different and why are they similar? So examining different points of view provides very valuable information about the social world and what are some of the contexts that surround the case. So these contexts might be political, social, relational, or economic. When analyzing the data collected in a project, researchers like myself might compare different cases, but also might look within a case. So in this example, I wanted to highlight how having different points of view or different perspectives might be used by researchers to tell us something new or innovative about a topic. So for example, during this interview with a patient, this person said, "My oncologist never listens to what I want." However, during an interview with a physician, the same oncologist the patient was referring to says, "I always listen to what my patients want. I am receptive to their suggestions when appropriate." So as a researcher, I might want to consider why are their perspectives different? Is it related to the physician role versus the patient role? Is it related to different expectations, access to knowledge, or perhaps different power relationships? So if we look at the data even more, and we consider data within the case, we might examine suggestions from a blog that the patient is reading. So the blog might state to the patient, "You should be in control of your medical appointment and demand to be heard." So how does this impact the patient and how the physician relates to one another? So you can see in this really short example, the potential of case study research to be very dynamic and exciting. So thank you for taking on this interesting journey with me about qualitative case study research. Although it's a traditional form of qualitative research, it's a really exciting way to conduct research in the health sciences. So I want to conclude by drawing together some key points. So read case study research if you need information, in-depth information, textual information, want answers to how and why questions, seek information about a topic beyond the cases that you are studying. If you're a novice or clinical researcher, you might want to conduct case study research if you want to study a bound topic, if you think it's helpful to collect different types of information, data like interviews, observations, documents, or if you're interested in collecting the different vantage points or perspectives about a narrow topic. If you're interested in reading more about this topic, I would encourage you or recommend the reading by Baxter and Dack. It provides a really good overview of the fundamental principles of case study research, and it's a really good place to start. If you're interested in actually conducting case study research, I would really recommend the book Case Study Research by Yin. It's more of a technical or detailed read, but it's by far the most quoted research book about case study, and it's essential, I feel, to take a look at. So once again, I'm Dr. Shah Mohammed. Thank you for listening.